There are a few images that spectacularly catch the astonishing scientific feats achieved by the human race. This is one of them. This is Neil Armstrong's first footprint on the moon. This changed space exploration and research, it transformed it. This is the first image of our human DNA. This essentially transformed biology. This is the first X ray that has ever been taken. For the first time, we could see bones, and this transformed the way we practice medicine. All these images are from the last century. What about this century? I think this is a spectacular image of this century which showcases one of the latest medical breakthroughs that's going to transform patient care forever. This is the MRI of the lower back of Nancy, who's a school teacher in Colorado. She was having severe low back pain. And I can relate to that because I was suffering from it. 20 years ago, when I was in Cincinnati being studying to be an anesthesiologist, I had severe low back pain shooting down the leg. It was so bad that I was limping. One of the senior doctors noticed that and sent me to a surgeon. He did an MRI, and not surprisingly, there was a badly pinched nerve with disc herniation. He suggested surgery. Then the senior most anesthesiologist told me, why don't we try a steroid injection in the spine? I didn't know anything about it, but he was my boss. I couldn't say no. So I agreed, and he did the procedure. And to my surprise, my pain went away. But I was one of the lucky ones because millions of patients with low back pain don't respond to any treatments or most treatments. It is a life sentence, it's very stubborn. Not only that, it's very common. As we speak, right now, across the globe, there are 60 crore or 600 million people suffering from low back pain. And it commonly attacks people who are productive, people who are working. So it is the number one cause of disability in the world. It's also very expensive. In the US, low back pain is the most expensive medical condition. US spends more money on low back than heart disease and strokes combined. So it's obvious low back pain is a curse globally. Wouldn't it be amazing if we have a new technology that can tackle low back pain and treat low back pain? I think we're very close. I think we have one, and that's what I'll be talking about. So, coming back to Nancy, she was suffering from low back pain for more than 6 months. She tried everything: physical therapy, steroid injections, medications, nothing worked. So she ended up seeing an orthopedic surgeon in Colorado, Dr. Petin, and he offered surgery, but she adamantly refused. So Dr. Petin did something very revolutionary, something that has never been done before, something bold, something gutsy. I would call it crazy. He took Nancy's bone marrow stem cells from back of her hip, concentrated them, and injected back into her disc. What happened? Within 3 months, her pain got better, her functioning improved, and by 1 year, her pain was almost all gone. He did this in 26 other patients and published the trial. 80%, yes, 80% of these patients got significantly better without surgery and avoided surgery. He did not stop there. He followed these patients, tracked them for 5 years, and even after 5 years, the pain did not come back. Amazing. This is groundbreaking in low back pain management. Dr. Petin deserves all the kudos, all the applause. But we should be more excited about what's happening in this picture that he published. If you look here, in the red circle, there's a disc. That's dark. And it's dark because it lost all the water. Water looks white on the MRI. You see, the disc is like a sponge. It has the same architecture as a sponge, and that's why it can hold water. When that sponge like architecture degrades or disintegrates, it's no longer able to hold water. And that's why the disc looks black or dark. That is disc degeneration. That is the number one cause of low back pain. So when Dr. Petin took Nancy's own stem cells and put it back in the disc. Look what happened a year later. The disc became white. It became whitish, it became brighter. What that means is the disc regenerated, the sponge like architecture came back, and now it's able to hold water. This is huge. Never happened before in the history of medicine. Why? Because there is no drug or no procedure that can regenerate the disc. And as you can see, it's actually a very subtle change. But why am I so giddy with excitement? Why am I acting like a kid in a candy store? This is why. For the first time in the history of medicine, we are taking care of pain with regeneration, with reconstruction. You see, until now, when someone came to us for low back pain, other than physical therapy, everything that we did was destructive, be it medications, injections, steroids, spinal cord stimulators, where we put electrodes in the spine, ablation, where we burn the nerves, and of course, surgery. They're all destructive. But now, for the first time, we are able to take care of pain with construction. Now, inspired by Dr. Peteen's results, I started doing bone marrow stem cells into the disc. I was not too keen initially, but my mentor and my guru, Dr. Manchikanti, Lakshmaya Manchikanti, he prodded me. And because of him, I started doing this procedure. But I took it one step further. I not only injected disc, but I injected other joints and also the nerves, similar to what I had. The reason I did that is, although disc is the number one culprit of low back pain, there are other structures, other joints and nerves also cause low back pain. So I wanted to cover everything. What happened? Patients started doing really well. But it's anecdotal. I wanted to do a clinical trial and see if this procedure, which was done for the first time, doing all the structures at the same time, injecting them, would it stand the test of scientific rigor? So we embarked on a very ambitious trial. This was the largest trial for low back pain and bone marrow stem cells, and first prospective controlled trial, and first time where all the structures were injected at the same time. We recruited 80 patients. This was done in Cincinnati. 80 challenging patients. I say challenging because the average duration of pain was 10 years. They were suffering from 10 long years. And many of these patients have been to many doctors, many physicians, had many procedures, many treatments, still suffering from pain, like a typical low back pain patient. And most of them had severe changes on the MRI. This patient population, 70% we could help increase their function, decrease their pain, and this pain relief lasted for 1 year. We tracked them for 1 year. Not only spine, and another important thing, 40% of our patients had disc regeneration, just like Dr. Peteen, just like this. Not just the spine, stem cell therapy can also help with other joints, knees, hips, and shoulders. So let me introduce you to Peter. Peter was a policeman in the suburbs of Paris. He was having severe knee pain, and then his doctor ordered an MRI. And as you can see here, that whitish discoloration within the red circle within the bone, that's severe bone degeneration, severe arthritis, which causes severe pain. So he went to see Dr. Hernigo in Paris. Dr. Hernigo did something very experimental. He took Peter's bone marrow stem cells and injected precisely into that bone. Again, bold and gutsy, never been done before. What happened? Peter's pain got better, functioning improved. 2 years later, he redid the MRI to see what happened. Magic. See that? That whitish discoloration disappeared, which means the bone regenerated, the arthritis got better. This is again unprecedented. This is huge. He did this in 140 patients, and majority of the patients got similar results. And he did something very remarkable. He followed them for 15 years. And even after 15 years, the pain did not come back. How cool is that? How amazing is that? So imagine this: you or your loved ones have severe back pain or neck pain or joint pain. You try everything conservative, you still have pain. You go to a doctor, the doctor takes your own stem cells, put it back where the pain is coming from, and your pain is gone, you function better, and there's joint regeneration. This sounds like science fiction, but it's not, it's real. Now, are stem cells ready for prime time for treating arthritis? Very close. I think we're almost there, but we need few more studies to validate. But I think we are on the right track. So when we take stem cells from a patient and inject back into the patient, it is called autologous stem cell therapy. There are two sources. One, bone marrow, like I was talking about. The other source will surprise you. It's fat. There are more stem cells in fat than bone marrow, actually 10 to 100 times more. So there are two issues with autologous stem cell therapy. One, the number of stem cells and the quality of stem cells decline as you age. You know, as we age, we heal slower. That's a perfect example. The other thing is we have to do an invasive harvest procedure, getting this, extracting the cells out. But we're still getting good results, as I've shown you. But can we do better? Can we get better results and much easier on the patient? Yes, we can. And that is using donor stem cells. That is called allogenic stem cell therapy, where you take other stem cells and inject into the patient. One of the best and richest sources of donor stem cells is the umbilical cord, which is thrown away as medical waste. We now have the technology to extract stem cells from the umbilical cord, multiply it in the lab, and bottle it in a vial and make it a drug. This is regenerative gold. But you may ask, if you're using donor stem cells, will there be a rejection? Will there be a reaction? The answer is no, fortunately. This is because mesenchymal stem cells are special cells, they're privileged cells, and the body does not perceive them as a threat, so they don't mount a response. That's why there is no rejection, there's no need to match. And one umbilical cord can serve 1,000 patients at least. There are three advantages of umbilical cord stem cells. One, you don't have to do a painful harvest. Two, they're very young and robust, highly proliferative, and most importantly, highly regenerative. Three, the most important benefit, and this will transform medicine, umbilical cord stem cells are capable of treating many, many complex diseases, challenging diseases that traditional medicine has no answer for. But there is a problem. But before that, the conditions that it can treat are very common conditions like heart disease, strokes, dementia, lung diseases, diabetes, kidney failure, heart failure, autoimmune diseases. The list goes on and on and on. But there is a catch, there is a problem. This is considered a drug and it has to undergo clinical trials and get drug approval. India is actually leading stem cell research. Our central government is pumping crores of rupees into stem cell research, and the state governments are providing us incentives. You see, approved stem cell drug therapy in the Western world is ridiculously expensive. Only a fortunate few have access to it. That's not untenable. In India, because of the support that we're getting from the government and the talent and the technology that exists here, we can manufacture stem cells at a much lower cost, at a fraction of the cost as in the Western world, without compromising on quality. As Neil Armstrong, when he was stepping his first foot on the lunar dust, he said, "This is a small step for man, but a giant leap for mankind." This picture, the change that you see on the MRI is very small and very subtle, but this is a giant leap for medicine. Giant leap because for the first time, finally, we're able to regenerate tissues, which means we can treat complex, complicated diseases that could not be treatable before. But We need approvals, we need trials. Once we get approval, and we need to get these approvals fast because millions of patients are suffering and millions of patients are waiting. Thank you.